Hey, welcome to today's video. My name is Emily Perry. I'm a speech-language pathologist, and today we are going to do a video on aspiration. In today's video, I'm going to break down what aspiration is, some things that can cause aspiration to occur, and signs and symptoms to look for. I will not be getting into treatment of aspiration in today's video, so if you have come looking for that, you will not find that here, and I will break down more why at the end of the video. But if you've come looking for a general overview of signs and symptoms and definitions, you've come to the right place. Let's jump right into it. So general overview, what is aspiration? Aspiration is when food or liquid is going to enter into the airway, and we do not ever want that to occur. However, it does very naturally occur for us in many circumstances. Everybody has aspirated at least once in their life, probably multiple times. But we know, having experienced it firsthand, that it does not feel good, and our body is fighting to respond to that because it is not supposed to go into our airway. So this can happen for a number of reasons and due to a number of anatomical causes. However, for the sake of keeping this video quick and short and simple, that's the general definition of aspiration: food or liquid entering into the airway, sometimes making its way all the way down to the lungs. Now, this can happen while you're actively eating or drinking, or it can also happen afterwards. If you experience GERD or acid reflux or vomiting, you can also aspirate at those times. So there's no need to panic if you or your child or someone you know or someone you're treating has shown signs and symptoms of aspirating a couple times or randomly or very sporadic. I obviously have gotten strangled on my water. I've choked on food before, not severely, but I have. And I think if you're watching this, you'd probably say, yes, I can relate to that. And so that we're not going to be super concerned about. When we need to start being concerned is when we see consistency and frequency with how the aspiration is happening and frequency with how often it's happening. So I'm going to break down signs and symptoms for you to look for today for whatever purposes you've come to this video. But remember, again, we're looking for consistency and frequency, mostly frequency. If it is happening very often, then we need to be concerned and we need to get evaluated. And if there's a certain pattern we're seeing consistently when it happens, then that is just helpful information to bring forth with you to the evaluation. So let's break down signs and symptoms. So the most obvious symptom and sign of aspirating is obviously the classic coughing, choking response. You know, they get strangled, they're choking, they're coughing, they're trying to work up whatever it is that made it into the airway. So I think we're all very aware of that, and probably if you're experiencing that or know somebody who is, there's no question in your mind, if it's happening frequently, that that person is aspirating in the moment and frequently. Some others that you may not be super familiar with or think that are linked to aspiration but often are would be as follows. So the first is going to be watery eyes after a swallow. So a lot of times for speech-language pathologists who work with these patients on a regular basis and who are very well knowledgeable in this realm, they're going to be looking at patients' eyes post-swallow. If there's suspected aspiration, we're looking if there is any wateriness happening in their eyes, and that is because all of this is interrelated. And again, I won't break it all down today, but signs of water in the eyes is a very common response when someone aspirates. In fact, if you ever find yourself strangled or choking again, and you might have the typical coughing response, actually go look at your eyes as well, and you'll find that you typically have watery eyes. Along with this, you can look for a deep inhale or exhale post-swallow. So if after they've swallowed, you hear a big that can be signs of difficulty with the swallow, which could indicate aspiration, something to look for. So another thing we're going to look for is multiple swallows per one bite of food. So if a patient is taking a relatively small bite of something, but we're seeing multiple swallows occur for that one bite of food, then this can also indicate struggle with the swallow. This can also lead us to believe that aspiration may be occurring. I'm going to demonstrate for you now how to look for swallows. So right here, your hyoid bone, you're going to watch it. It's gonna raise. So if you see me chewing and then you see me going like this, I can't even swallow twice. If you see it raising multiple times for a small piece of food, that may be cause for concern. Again, let me just say this. These are all signs and symptoms. These are not diagnostic measures for you to diagnose yourself with. You have to go be seen by a trained and certified speech-language pathologist or other profession that specializes in dysphagia, swallowing disorders, aspiration. Please do not try to self-diagnose yourself. I'm only making this video for situational awareness, for education purposes, and just so that if you are suspecting that this could be happening, that you can better have clarity and understanding of what it looks like. Okay, another one that we as speech-language pathologists are going to look for is the tongue pumping and groping. And so your tongue actually could be struggling to get that bolus back could be avoiding the swallow because of an automatic response that it's having to signs of aspiration. So we're going to look for any abnormal activity with the tongue when you're chewing, eating, and swallowing. Okay, I mentioned the runny eyes. We're also going to look for a runny nose. Same thing, they're all interconnected. We want to see if that nose is running consistently at the same time that somebody is eating or drinking something. That could indicate to us that aspiration is occurring. We're going to check the mouth after a swallow of liquid and food. Obviously, liquid's going to be a little bit more easier because it's likely to come out, but food you might find pocketed in the mouth somewhere. That could be a sign to us of aspiration. If they're not able to get that food down and cleared out of their mouth, could be an indication that something else is going on. Okay, and I mentioned the multiple swallows. We're also going to be looking for a prolonged or excessive swallow. So if it's taking a long time for one swallowing sequence to occur, then that could also be an indication that something is going on. From a medical standpoint, which even I would not be trained to watch this, so do not try to watch it on yourself, but we would also be looking for heart rate changes and oxygen levels. So if this is a patient in the hospital or being evaluated formally and they're hooked up to something that is showing heart rate and oxygen, that can be an indication of food or liquid entering into the airway. Again, I'm not going to get into that a ton because that is not my scope of practice, but that is something that medical professionals can look for, is heart rate and oxygen changes. And then real quick, I just wanted to break down that if you're working with someone with special needs, perhaps someone who is autistic, then you may be looking for food aversions or food obsession. So if there's specific foods they're always avoiding and foods that they're constantly wanting. Now you have to be careful with this because we know that autistic people will have some texture difficulties most of the time with feeding, eating, swallowing in general, but this can also indicate something further. So it's important to be aware and to know to look for those things as well. So we're looking for food aversions, food obsessions. Does this pair consistently with other signs and symptoms that we think could be happening for aspiration in an autistic person? And along with that, we would be looking for any abnormal eating patterns within them. So you have to remember that children and adults with communication difficulties, they can't always tell you how they're feeling or what they're experiencing. And so we have to be able to look for these signs and symptoms. And this is, I'm going beyond the realm of special needs now. This is all of us, right? That if we are struggling to communicate these things, people cannot know. So we have, as trained professionals, we have to be able to look for these signs and symptoms. We have to be able to piece pieces of information together, and we have to be able to know how to put two and two together to have a right concern. So these are just some basic signs and symptoms you can be looking for, whether you're thinking that you yourself might be aspirating or somebody you know, or you're just trying to educate yourself, or you have a client, or you treat patients actively and want to refresh. These are just some signs and symptoms to look for. Again, you cannot take this video and self-diagnose yourself or anyone else. If you suspect and this video only confirms that suspicion, then you should go get seen in person for a proper evaluation and treatment. My videos cannot serve to diagnose. They are only out for informational purposes. And that is why I'm actually not going to get into treatment in this video, because aspiration can very much lead to pneumonia and other medical difficulties. And so I really want to encourage you that if you feel you or someone you know needs to be treated, go in person and seek out that proper evaluation and treatment. As speech-language pathologists, if aspiration is suspected, we will complete something called a modified barium swallow study. And this is actually just an x-ray of your swallow, and we will mix barium in with your foods. So a lot of times you'll do ice and liquids, and then we'll do applesauce, maybe mix in a graham cracker or something of the sort to make it thicker. We're going to watch that swallow take place multiple times with that barium so we can see if actually any of that food or liquid goes into the airway instead of down the esophagus into the stomach like it is supposed to. And we can also see if it's coming back up from the stomach due to acid reflux, lower esophageal sphincter problems, anything like that. We can see if it's coming back up and going into the airway from the below portion. So MBSS, modified barium swallow studies, are very, very helpful, and highly encourage you to go look for a referral for one if you feel you need it. I hope this video was helpful for you. It's really fun for me to be able to do the medical side of my field, because sometimes, even though I stay at home with my kids, I still love to refresh my mind in that area, and it's actually one of my secret loves is the medical side of our field. So this is really fun for me. If you have a video that you would like me to make in regards to speech-language pathology, please comment below and let me know. Thanks for stopping by. If you're new to my channel, welcome. Please subscribe. I'd love to have you, and like this video if it was helpful for you or you enjoyed it, and I'll catch you guys in my next one. Bye. There's like a huge wasp in here. Can y'all hear that? Okay.